by the pathogen on the host and how they are managed or controlled. And before that, you should know the basic concept like sign, symptoms, epidemiology and IPDM. So symptoms, as we know that, what is meant by symptoms? In Marathi, it is called as an lakshane. So symptom is nothing but the expressions of diseased condition by the host due to attack of pathogen. Means what? Due to the attack of pathogen, some of the plant, they produces symptoms on the leaves. For example, change in color of leaves, change in shape of that leaves, or any abnormal activities shown by the plant. It is called as an symptoms. But this is not the exact, or this is not, or that symptom does not provide the exact presence of pathogen on the host, or exact or accurate diagnosis is not possible due to the only symptoms, because the symptoms, it may be caused due to the deficiency or excess of nutrients, or it is due to the biotic factors, or that means it is due to the attack of pathogens. It may be fungi, bacteria or virus. So we can't confirm that the exact presence of pathogen due to symptoms. Okay, so for that one concept is there, that is sign. So sign means what? The exact presence of pathogen on the host. That means this is your host, that is called as a plant. So exact pathogen which is attacked on that host, so we can identify due to the microscopic examination, and that exact presence of pathogen is called as an sign. Okay, so how we have to identify? Just we have to cut the infected portion of the plant, make into the fine pieces, and just we have to observe under the microscope. So on the basis of shape, size, color and any other specific morphological character, we can identify the exact presence of pathogen, or which exact pathogen is responsible to cause disease. So due to that sign, it is possible for the accurate diagnosis of disease. Then this is about your sign, that is exact presence of pathogen in the host. Then epidemiology means what? Those factors which is responsible for the sudden spread of disease. That factors is called as an epidemiology. For example, the biotic factors mostly or abiotic factors that spread the high, or that spread the disease at a faster rate. For example, wind, water, animals, insects, seeds, etc. Then IPDM means what? Then as we know that in previous lecture, IPDM, that is integrated plant disease management, we have to utilize the combination or all possible methods of disease control for management of disease. For example, we use cultural method, physical method, mechanical method, biological method for the management of that disease, or for the control of that disease. It is called as an IPDM or IDM. So this is a basic concept of that. Before conducting the before identifying the symptoms, you should know that basic concepts. Next one, as we discuss here, next one, classifications of symptoms. In that, hypertrophic symptoms, hypotrophic or hypoplasial symptoms and necrotic symptoms are observed. So hypertrophic symptom is what? As you know that hyper, that means excessive or over. So overdevelopment of infected tissue in host is called as an hypertrophic symptoms. For example, leaf curl, tumors, leaf galls or root galls are the best example of hypertrophic symptoms, because excessive growth, as we know that galls means excessive tumor like growth on the roots. So in next slide we discuss about the hypertrophic symptoms, which are those again. Next one, hypotrophic symptoms or hypoplasial symptoms. So as we know that hypotropic or hypoplasial means what? Hypo means what? Reduction or underdevelopment. So there is an underdevelopment of plant or different parts of the plants due to the infection of pathogen. then it is called as an hypotrophic or hypoplasial symptoms. For example, stunting, bunchy top, little leaf, chlorosis, mosaic, mottle, etc. These are the examples of hypoplasial symptoms. Next one, necrotic symptoms. Necrosis means what? There is a sudden destruction of the infected tissue due to attack of pathogen, and due to that plant shows the burning appearance, or just like the plant shows the just like a burnt, or plant parts are burnt. So simply the example is anthracnose, leaf spot, leaf blight, wilt, cankers, blast, etc. So these are the classifications of symptoms, that is hypertrophic, hypotrophic and necrotic symptoms. So among that, necrosis or necrotic symptom is most important. So let us see one by one here. What are the hypoplasial symptoms? As we discussed in previous, chlorosis, yellowing, pallor, mosaic, yellow mosaic or yellow vein mosaic, mottling and dwarfing. So these are the hypoplasial symptoms, that is the reduction or underdevelopment of tissue which takes place due to the attack of pathogen or due to the excess or deficiency of nutrients. So in that we discuss one by one. First of all, chlorosis. So as we know that chlorosis means what? There is a complete loss of chlorophyll from the leaves. So that is called as an chlorosis, that is loss of chlorophyll from the leaves due to the excess or deficiency of nutrients or due to the attack of mostly virus. So plant shows chlorosis. So this is an healthy plant and this is your infected plant. This is called as an chlorosis. There is a loss of chlorophyll from the leaves. Next one is the yellowing and pallor. So as we know that yellowing is nothing but the chlorosis, that is partial loss of chlorophyll from the leaves. Then it is called as an yellowing, as we discussed, as we shown in diagram. Next one, the pallor. So pallor means what? There is a partial destruction of chlorophyll in the form of the streaks. So that means small streaks are observed, that is yellowish streaks are observed due to the loss of chlorophyll. So this is called as a pallor. Next one is mosaic. So as we know that mosaic is nothing but there is a loss of chlorophyll in uneven patches. That means there is a loss of chlorophyll here, but in the patches. So due to that, here yellowish green color are observed on the leaves. Sometimes yellow green color are observed on the leaves. So this is called as a mosaic. That mosaic, it is a viral symptoms, or it is due to the viral attack. But most of the time, due to the excess of nutrients or due to the deficiency of nutrient, such a yellowing is observed. Just like in here, yellow mosaic. Here it is shown by here that patch is completely attacked by the virus. So this is called as a yellow mosaic. That plant is completely yellow due to the attack of virus. Okay. Next one, yellow vein mosaic. So name itself indicates yellow here, yellow vein